Hey guys, Dr. Gandhi here. I'm with two very special people, Dr. SimonYu and Dr. Atel. Dr. Atel is from Germany, all the way over there. So today we're going to talk everything parasites, dental related, biological dentistry, and put this whole perspective together. Because if you haven't been feeling well, there could be something underlying. And we want to try to get to the root cause of everything instead of doing patchwork. To start it off, can you please introduce yourself?
I'm Dr. Simon Yu. I'm an internal medicine physician, and I've been doing what we call integrative medicine for the last 30 years. And I guess I become more specialized in looking for hidden parasite problem and hidden dental problem. That's how my study starts and private company end.
Awesome. What about you, Dr. Atel?
My name is Dr. Atel Hamet. I'm from Germany, and I got introduced to Dr. Yu in 2018 and by Dr. Hermann Retzek from Austria, and ever since I have been implementing his AMA system to treat and diagnose and treat patients with dental and parasite issues.
Wow. Interesting. You said a very specific 2018 is that's when I started to dive down into this biological dental super. Yeah. So I started learning from my mistakes. So 2018 is it's a marker. Yeah. So Dr. Yu, what first sparked your interest in parasites?
Well, I knew a parasite about the effects of it from basic medical training. And Hulda Clark talks about is a Canadian naturopathic doctor talk about parasite. So I did use some of our recommended parasite remedies like walnut, clover, and the wormwood cornflakes with a moderate success. And then when I was in military for 25 years as a U.S. Army reservist. We're in Bolivia, year 2001. We're using parasite medication, parental palm oil and mebendazole, the most inexpensive medication. We took 10,000 people. When I came back, I decided to use some of the same parasite medication I used when I was in Bolivia, year 2001. This is where I noticed the dramatic change my patient's response, which turned into my book called Accidental Cure. Because I didn't know why people are responding, but totally, what I'm thinking, not related. Like an example would be asthma. That's the person I noticed. Ideas, you do parasite medication, they get better. But many times the people say their asthma or bronchial symptom gets better. It took me for a while to connect the dot. There was a parasite and the lung relationship.
Very interesting. So when you started the combination of the medications, things started to change compared to the homeopathic or botanicals.
Right.
Okay. Very interesting. What about you, doctor?
Yes, I agree that in patients that are chronically sick, you need to use prescription medication in order to get them back to their healthy selves. With the botanical or homeopathics, usually you're just masking the symptoms.
Your experience now has completely changed because from 2001, when you started getting very successful outcomes, the patient started to feel better, you changed your protocols. And then you wrote about it in Accidental Cure, which is your first book, which is a great read. What changed between, and then you wrote a second book, Accidental Blow Up. So what changed between Accidental Cure and Accidental Blow Up?
Probably I emphasize more on dental aspects of it. Because even if you go through the parasite cleansing, if you have a dental problem, if you have this reinfection, this how to break that cycle until you go through the complete the dental work to be done. People don't think about it, but dental have its own dental parasite. As much as it's very complicated aspects of it, besides the mercury and bite, and a dental as a microbe, a dental parasite as its own separate entities.
Which is interesting because as a dentist, we don't think about parasites, right? That's traditional dentistry, form or function. You could chew with the tooth, the form of it's good, the function of it is you're able to chew, masticate food, everything's okay. Underlying, there could be some problems, especially with bone. As biological dentistry, we're looking for oral interference fields, and that's one of the reasons why I connected with you so well. Oral interferences, it could be a metal, which are mercury filling, or metal filling, a metal crown, titanium. And then that's one interference field. The other two major ones are if you had a tooth taken out and there's a ligament that's left behind if the bone was not cleaned properly. Now it's a cesspool of pathogens because the tissues covered it. As we know, a lot of these bugs are anaerobic and they love the environment because they're being fed. They start to grow. And then the other one is any dead tooth, whether it's a root canal tooth or trauma. That's the stuff that we want to evaluate to see if that's what's causing the symptoms. We look for those areas. We do a CAT scan or CBCT, and we look for if there's any areas around in the jawbone. The part that I really connected with you in May of this year was that, yes, I can clean the jawbone. I could take out the tooth, get the patient healthy upstream up here. But what about what's downstream? And that was eye-opening because a lot of your patients are all being treated downstream. And when you start cleaning them downstream, then we have the teeth left to deal. So when you do the combination, you find a whole different person that comes back to light.
Exactly. We have to treat the whole body. As a physician, we overlook dental aspects of it. And as a dentist, I look at the rest of the body. And the real question is how to connect the dot between dental and the rest of the gut. That's my book is about, talking about Meridian system.
Correct. Can you explain the meridians a little bit more?
Well, the acupuncture meridian system is known for thousands of years. People say 3,000, 4,000, 5,000 years. Really, who knows? But so the whole concept is known for thousands of years. But the German physician kind of figure out the code, how to measure the actual meridian system far more reliable than just checking for the pulse. So we are measuring the actual conductance and resistance at the acupuncture point and call it electroacupuncture according to Dr. Voll, VOLL. And it's a very complicated system, and eventually after modified to fit into my need, and I call it acupuncture meridian assessment, and get to the main point within 10-15 minutes of where to focus on. And then from always job on any chronically sick patient.
Which is very interesting because we are so familiar with acupuncture, right? You see acupuncture all over, you see clinics for acupuncture. But when you say you can measure the acupuncture, right? That's something totally different. And it's hard to believe unless you go through it or you can show someone, right? Is that your same belief, Doc?
Yes, definitely. I was familiar with acupuncture before, but the EAV method that was developed in Germany wasn't broadly accepted even by naturopaths because it was very difficult, very complicated system, like measuring more than 600 points in one, like 3.5 hours. So it was a very complicated system. So I was very intrigued by Dr. Yu's system that narrowed it down to 40 points mainly and measuring them very fast and shortcuts to get to the real issue, and then the prescription medication that were easy to balance them out. This change in the method by Dr. Yu is what made me come several times to the US and attend the seminars in order to learn it. It's still something a lot of patients or people have difficulties understanding or grasping. They have to see it for themselves in order to grasp it.
Can you give a patient experience that you've walked them through their journey and see like from start how they came in? And then
most of the patients that I see have chronic fatigue syndrome. I don't see a lot of cancer patients, so most of my patients have chronic fatigue syndrome. They will come in and have the typical average patient will be between 20 and 40 and have different issues regarding the bowel, so IBS usually. They'll have cramps, diarrhea, or insensitivities towards food allergies, and have issues with the mitochondria, with the overall energy. And the patients usually also have cavitations in the wisdom tooth area. So when I measure them, do the first AMA, I will have protocol of certain parasite meds that I recommend before they do the first surgery, cavitation surgery. So they go through that 2 or 3 months and they do the surgery. Around the surgery, it's important to have them take certain medications, because if you open up the cavitations, you will excavate materials, bugs, bacteria, viruses that need to be treated. Otherwise, they will reinfect the body. So usually the patients are on a protocol of medications around the surgery as well. And once they did 3 cycles of the medication, the surgery, they might come back for another 3 cycles, and then they regain their energy and can go back to work. So this is the typical patient story. It doesn't happen overnight, but if they do the dental work as well, they will achieve the goals that they set themselves. If they neglect the dental, the parasite medication usually is not enough to fix the issue.
Got it. So it reoccurs. Yeah, they don't. Okay. What about you, Dr. Yu? What's a patient experience that completely changed everything to be?
Explain to my patient when they come, I have no idea what the diagnosis was. I don't pay attention to their diagnosis. I tell my patient, think of like your body as a violin, but out of tune. I'm gonna inspect the violin and tuning the violin. That's all. So I don't want an actual diagnosis per se, but a lot of cancer patients come to see me, a lot of neurologic patients besides chronic fatigue. So think of our body as a fine musical instrument with 40 strings, because I'll be measuring 40 meridian as a system that I'll check, inspect, and then I will give you a recommendation that usually including parasite problem to be addressed with a multiple parasite medication to balance particular part of the meridian system, and the dental environmental toxin. And if they come early enough, their problem will go away, regardless what the diagnosis is. Everybody have a little bit different story to tell. Yeah.
Makes sense. What is your take on parasites in a developed country? Because we're usually taught like parasites don't exist in developed countries. Third world countries, you probably got something, so you got sick, but then there's antibiotics that are given. The truth of it is almost parasites exist everywhere. It's not just there's borders for them, they're without borders. So what is your thought about parasites in the US?
It's one of the forgotten preventive medicine. The old timers used like a castor oil, wormwood, or clover as a deworming at least once or twice a year. At least that's what I've been before.
Yeah.
But now we are assuming with a better hygiene, we don't have to worry about it. But it's a sad, but it's a forgotten preventive medicine that we need to reactivate it as a public awareness. The routine deworming process should be probably as a public routine, not just using natural parasite remedies, but using prescribed medication.
So it's not a one and done, because in dentistry, especially like the way I'm working on patients and comprehensively, once the stuff that shouldn't be there or is affecting the patient, once it's gone, I call it one and done. Like you don't need to see me again, and you might not even need a cleaning ever, as long as your hygiene and your diet and nutrition's good. But here with the deworming and parasites, it's something that we have to stay on routinely. It's not just you did the protocols once and hey, I'm good for life now.
Well, I love to tell this story about one of my patients from Iowa. I evaluated her and give a parasite medication, and she looked at it, goes, "Wait a minute, this is the same medication I'm giving to my horse." She's raising her horse. So we talked about this conversation about the horse, and in old days, the horse, their lifespan is 20 plus years, maybe 25 years, whatever. But now the routine deworming twice a year for regular horse. I've been told racing horse, they deworm 4 times a year.
Interesting.
Improving dental care, basic nutritional support. Now the horse can easily live 40 plus years, almost doubling the lifespan by regular deworming and dental care. Why can't they apply that to a human? But anyway, that's I love to tell that story.
Yeah. What about you, Doc?
Yeah, I definitely agree. The one thing is that with the dental care, you're reducing chronic inflammation, and chronic inflammation is also one of the key factors that causes aging in the body. And the other thing is that the parasite medication that we're using is not only working on parasites, it has pleiotropic effects on other parts as well. It works antiviral, anti-cancer, and it works on different cellular mechanisms that have a longevity effect on the body. So I always think and I always will recommend patients to do regular deworming as a preventative measure.
Interesting.
Dental care and deworming, I think that's the most effective ones.
Absolutely. And you're in Germany and you're dealing with parasites there too.
Yeah.
Right. So it's a whole worldwide issue. It's not just localized.
Definitely, and people are traveling all around the world. They're going to Thailand, to Egypt, and they expect the parasites to stay there. And then they come back. They're going to third world countries, and then they're coming back and exchanging saliva with their pets. They're expecting only the pets to be full of parasites. So the problem is also the pets being very close in the house and very close body contact to the pets. This is something that is new to Western countries. It wasn't like that decades ago. Cats used to be outside of the house. Now they're sharing their beds with the pets. So and they're eating more and more raw meat. So these are all routes where parasites can come into the body. And then some people are more prone to attracting parasites, people with dental issues usually. So it's not everybody that's susceptible in the same way. Yeah,
It's interesting how dental keeps coming up into the mix. We'll deep dive into dental soon too. What are some early signs that someone has a parasite infection or infestation?
It should be very subtle. Could be just fatigue, or maybe insomnia, some GI problem, bloating, gas, and then it gradually developing to more and more deeper level. So you have to always look for sign for GI problem. But we have a lot of these parasites outside the GI tract, so we have to think about just even muscle pain, joint pain, migraine headache, asthma is very common. The parasite love goes to the lungs. So all doesn't play the role. Allergy problems are another one. Suppressing your immune system. Cyst is a big one. And eventually, cancer is a big topic. But I have to be careful not to say too much about it. But I've seen so many cases. They get improved by sometimes tumor disappearance.
Very interesting. I mean, so it's the C word, right? Cancer. Like, it's like all of a sudden we say that word and we're blacklisted, right? But the truth is, there are more and more doctors talking about it. There's even patients talking about it, that they had parasite infection, they did this. Not saying it's all in all cure, not saying one thing's going to cure everything, but in your knowledge and your expertise, there is a linkage there, right? Between the parasites and cancer, right? And you've treated a lot of patients who didn't want to go the traditional route, but they wanted to go alternative route, and they got better, right? It's not a miracle. It's cleansing the body. And once you cleanse the body, the human body can heal really well. So that's something that we need to, that you can do whatever, and you can do whatever treatment options you want to do, but at least the patient has options of which road they want to take.
Oh, absolutely. I think there are enough research to talk about connection with the parasite and metabolic disturbance and all those cellular signaling pathway. One of the latest literature talk about parasite medication affecting WNT signaling pathway. It's a big topic right now. Big pharma is betting money on how to regulate the WNT signaling pathway to control the cell proliferation and anti-aging, repair. So they're betting money on it, but when you look at the literature on parasite medication, guess what they do? Not only go after the parasite, they regulate the WNT signaling pathway. We already have the information for anti-aging medication.
And what about you, Doc? What's your connection, or is there a connection or anything that you feel since you've been down this road?
I think cancer and parasites, there's definitely a connection, because from a cellular point of view, there's also similarities between both of them. So the cancer cells, they are out of control. They derive from body cells, but they don't respect the boundaries anymore, and they'll be like after their own benefit only. Parasites are similar in the host's body, so they will use the host to grow. The mechanisms of the medication, if we use mebendazole, for instance, it inhibits the angiogenesis, for instance, in the parasites, but also in the cancer cells. At the same time, the normal body cells are not susceptible to these mechanisms, so the body will tolerate the medication very well. And on the cancer cells, it will have chemo-like effects on a cellular level. So
very interesting similarities. Yeah, because dealing with the jawbone, especially with the cavitation areas where teeth are removed and it's not cleaned properly, there's elevated levels of RANDs, which is CCL5. If you run PubMed, there's like 10,000 articles linking it to almost every type of disease there. Then there's also interleukin 1, interleukin 6, and TNF alpha. why are those elevated? Now, if those are elevated in the jawbone, imagine where else they are. And the biggest thing is that when you do some of your blood works, you're not finding the elevation there because the jawbone is walled off, right? It's compartmentalized and there's not enough blood flow there. So then the patients will think like, hey, everything's okay. But no, they have so much disease that it's sort of chronic hidden infection. So that's why it's good to put all this together, right? And then this way we get the best outcome, which is really nice. What are lifestyle factors that can be preventative from trying to get a parasite?
Lifestyle,
Yeah.
such a broad topics. I mean, if you think of not only the diet and stress management, sleep. If you don't sleep well, nothing works very well.
Yes.
And also so all the basic stuff.
Yeah.
In terms of the diet, people ask me, and I don't take it, not that I'm not taking it seriously. I like to know your patient's metabolic type. It's very important. Are you a fast oxidizer or are you a slow oxidizer? It's a way to think, how do you process food? So I give us a better idea what proportion of the fat protein can your body need. So I give a diet according to your metabolic type.
Okay.
And I always check for allergy problem, food allergy problem. And sometimes people will say,